You have that warmth. You feel welcome when you're in your own home. You feel all these feelings that you had before. You can almost feel them just like if you were young again. I've been here almost all my life. I was born in that room. Me and my brother used to get in quite a little mischief. We didn't have TV, so we entertained ourselves, and we spent most of the time outside. We used to play hide and seek, kick the can.
Music has taken me places that I never ever imagined that I would go. I've been to London, Paris, Wales, Germany. This is all as a result of my singing.
Oh, I had a beautiful childhood. No problem. I'm a 16th child. I had big fun. Oh, man, it was beautiful. Never no problems. We never had nothing to worry about. Everybody went to school. Everybody did their thing. And the oldest took care of the next, and the next took care of the next on down the line.
Even as a child, I was not only tall, but heavy, but it just got out of control. I weighed over 400 pounds. I was doing like 70 units of insulin every day.
Well, it happened that I had an accident. When I came from the hospital, I was at this Loving Care, and I stayed there for a while, for 6 months. How would you have to pay rent for one room and stay in one room all day? It feels terrible.
Me and my wife broke up, and I hit the streets on my own. I just said forget everything else. Cocaine, marijuana, you name it. I was out there dancing with it, Jack. I buy a pint, my partner buy a pint, then the other partner, he buy a pint, so that's half of the day gone right there. I'm talking about I drank every day, all day.
I really didn't have adequate insurance. Sometimes I would go without insulin because I couldn't afford it. I gotta buy groceries. At this point in my life, I have been through so much. This is one of the reasons that I'm so grateful for PACE. 30 days after I became a participant, I was laying on my deathbed. I was so sick, and through all of that, PACE was there with me.
There is no model that does what PACE does. And what we provide is all the clinical care and all of the support services that are needed to allow somebody to stay in their home. I think staying in the home is important to people because it's what they've known, right? We all seek home. It's what we know, it's where we feel comfortable, it's where we feel safe, it's where we have predictable routine, and we know where our furniture is at, and we know where our food is. And so when you can keep somebody there, their life feels more secure.
First of all, I think it's important to understand that many of the people that come to PACE have many needs, and for many of them, they are needs that have been unmet for a number of reasons, because they didn't have the insurance coverage, they didn't have a way to get to the physician. But when they come to PACE, what we're able to do is to provide them a comprehensive plan of care. So whatever the needs are, we are able to manage, monitor, and make certain that those are fulfilled.
There are no out-of-pocket expenses for them because we are the health plan, we are the insurer. And we provide all their medical care, we provide all their prescriptions, we provide their home care needs, we provide all their rehab services, we bring them into our center, we provide the transportation that's needed.
To be able to say, I need to go to the doctor and I'm not worried that I'm not going to be able to afford this. I need to go to the emergency room. I'm sick. It's like, this is all taken care of. And when you have that peace, you're able to get well.
They come to see me and they ask me if I was interested in this program, and I said, yes, definitely. Well, I can walk where I want, I can do what I want. You don't know how much you appreciate your home till you're not in it.
When we can provide additional support, whether it's home care or doing some housekeeping, making certain that it's safe there, that they can get in and out of the house without any safety hazard or fall or trip hazard, it makes a huge difference.
In addition to that, we have day centers, and in those centers we have clinic urgent care, we have a day room where there's recreational types of activities to keep them socially interacting with others, as well as stimulating their cognitive abilities.
They started working with me by getting me another place. They talked to me and told me this alcohol is not necessary. I come in, I talk to them, have a little fun, and eventually I wouldn't do it no more.
I think it's more like to get out a little bit. If I didn't have them, I would know I'd be more lonely, you know what I mean?
I'm just like at home here. I've been here so long now. It's just like, going home. If I need anything, I get it.
And I'm relatively healthy now because PACE. It's really enhancing my life.